So, good morning, good afternoon, it may be even a good evening to our participants and our lovely panelists who are joining us for this webinar. I would like to thank the Center for Global Health Policy and Politics and our equity for bringing us together once again to continue this critical dialogue, litigating for change, advancing SRHR through justice and advocacy in Southeast Asia, which is, of course, our third webinar in our Sexual and Reproductive Health Justice series. And we know for millions of people throughout the world, the enjoyment of the highest attainable standard of physical and mental health remains a distant goal. And in many cases, this goal is becoming even harder to reach. And I know this firsthand as the UN Special Rapporteur on the right of everyone to the highest standard of physical and mental health, Dr. Tlaleng Mofokeng, that it's important that we understand sexual and reproductive health as integral elements of the right to health. And yet we know that so many obstacles continue to stand in the way. These obstacles are often interrelated, they are entrenched, they operate at different levels in clinical care, at the level of health systems, and in underlying determinants of health. And today's series talks about strategic litigation and often what I call the legal political determinants of health. And so we have to understand discrimination in how it affects accessing healthcare services as a pervasive issue globally. Women, girls, and gender diverse persons face numerous barriers when seeking healthcare, including the denial of care, unequal treatment, and access barriers to reproductive health services. And these discriminatory practices not only violate women and LGBTQA plus persons' rights, but they also contribute to poor health outcomes, exacerbating as well existing health inequities. And even before the COVID-19 pandemic, for example, there was already a high level of unmet need for sexual and reproductive health services and commodities. And in 2019, an estimated 218 million women of reproductive age in low and middle income countries had an unmet need for just contraception. And so we know that many people are still without the basics in sexual and reproductive health rights. The two world subregions account for the highest level of unmet need for sexual and reproductive health rights, which are what is commonly called Sub-Saharan Africa and South Asia. And this is why this conversation today is so important, because each of the world of these regions face different challenges when it comes to sexual and reproductive health rights, influenced by various factors. Of course, each country's social and economic conditions. We know issues of conflict and post-conflict settings, as well as many other diverse and dynamic, social issues which shape how norms are created and informed. And so, one way that this issue has become really thrust back into the spotlight and why the issues we are going to discuss today are so urgent. It's the reliance on donor funding for sexual and reproductive health services. It's the fact that we are still depending very much and very heavily on philanthropic aid for very critical infrastructure and care services around sexual and reproductive health. So, with the idea of decolonization of aid, democratization of aid, what do we do? What is the political agenda? What do we say about all of these particular neocolonialistic trends that we find are affecting our ability generally as global health to respond, but specifically sexual and reproductive health rights? Now, strategic litigation, advocacy for constitutional reforms, and sustained civil society participation have proven to be powerful tools for advancing sexual and reproductive justice. It is needed to insist on strengthening health systems, ensuring legal accountability, and recognizing the rights of vulnerable groups, including, in many instances, youth, people who use drugs, sex workers, LGBTQA plus populations around the world. And as we are here today, I'm incredibly privileged to be joined by distinguished speakers who I'm going to be introducing to you in a moment at a critical time to see what lessons we can all learn through this dialogue on advancing sexual and reproductive health rights in the South, but particularly learning from the experiences that they carry in the Southeast Asia regions. And I'm so honored to introduce to you all today. Her Excellency Ms. Nochetra, the Director General of Social Development Department in Cambodia. Thank you very much for your time. Sarah Malkani, who's the Advocate High Court of Pakistan, and in the law office of Sarah Malkani. Thank you very much for joining us as well. Payal Shaham, who's the Director of Research at Legal and Advocacy at Physicians for Human Rights. And not least, Tilaga Sulatire, who's the co-founder of Justice for Sisters in Malaysia. And thank you for all that you have done, that you continue to do in this important area and a theme of all of our work. And I want to start immediately by asking Her Excellency Shosetra that in your tenure as Director General of Social Development, you oversee departments that intersect with sexual and reproductive health rights, including legal protection and women's health. How do you perceive the role of legal frameworks in advancing sexual and reproductive health rights in Cambodia, and what strategic litigation opportunities exist to reinforce these particular frameworks?
Thank you very much, Dr. Thalang Mo Phokheng. Good evening and good morning, good afternoon for Cambodia, and I am on behalf of the Ministry of Women Affairs. I am very pleased to participate in this important webinar this evening, and I'm happy to share with you about the experience of Cambodia in advancing the sexual and reproductive health and rights in Cambodia. Are you may aware that Cambodia have ratified several international conventions related to human rights, including the CEDAW Convention and the Child Rights Convention, and also the Convention on the People with Disability. And Cambodia have integrated the key principle of international convention related to human rights into our national law, policy, and framework. And so far, we have Cambodia commitment to the well-being of our citizens, particularly in the to promote for the high quality of healthcare, and also the we have mainstream gender into law and policy and framework. So to answer to your question as the role or my role to pursue legal framework in advancing sexual and reproductive health in Cambodia, and what strategy litigation opportunity exists to reinforce this framework. I would like to uh, 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 answer that the role of legal frameworks in advancing sexual and reproductive health rights in Cambodia is very important, and it is multifaceted. And this framework helps to formalize rights and outline the state responsibility and provides mechanism for redress when the rights are violated. However, the effectiveness of this framework depends on both the content of the laws and political, social, and cultural environment in which they are implemented. As I already mentioned that we have mainstream the principle of international convention to our law, such as the Constitution of Cambodia, guarantee the right to life, liberty, security, equal rights for men and women, and also the law on the prevention on domestic violence and protection of the victim, address violence within household, including also the sexual and reproductive rights. And the abortion law also allow the abortion within the first 12 weeks when sin informed consent, exception allow death after under the specific condition. And we also have the national policy under the leadership of the Ministry of Health. They have the health strategic policy and also have a national strategic development plan and health, including the what we call the national strategic for sexual reproductive health. We complete already the 3 versions in the 4th version in 2006 to 2010, and the second in 2013 to 2016. The third is 2017 to 2023. And now the Ministry of Health is finalizing the 4th national strategic plan on the sexual and reproductive health for 2025 to 2030. And this strategy is aligned with the commitment that are made at the International Conference on the Population and Development in Nairobi in 2019. And to align with the Nairobi commitment, and that we already commit in the Nairobi to achieve the 3 transformative outcome by 2030. The first about the eliminating prevalent preventable maternal death, meeting all family planning needs, and reducing the gender-based violence and harmful practice. So in order to achieve this, our next national strategic plan for the sexual and reproductive health and rights for 2025 to 2030 is finalized and also will provide the clear guiding to us to work for the improvement of all Cambodian people, particularly girls, women, and to ensure no one is left behind to exercise their rights to sexual and reproductive health and well-being by 2030. And this strategy is we are focusing on the creating the enabling to increase the adolescent leadership and participation to the sexual reproductive health opportunity to accelerate the improvement in health outcome and equip future generation for the sexual reproductive health leadership. And also we will use the technology and digitalization to increase the knowledge and the information related to the sexual and reproductive health to our people to access the service, and also to have a specific activity to target the intervention to reach the key population in the where who are the marginal group or vulnerable LGBT and indigenous people. And And also the national strategic action plan also focusing on how to address the harmful social norm and also promote the gender equality for the um, both young men and girls to access the service, and also focusing on capacity uh, strengthening of the service provider, including the law enforcement officer about the gender equality, and also the knowledge on the sexual reproductive health and reproductive rights.
Thank you so much for that broad landscape of the frameworks currently and the situation in Cambodia. I think it's very helpful to understand as we delve deeper into the conversation. And Sarah, you are next in terms of your experience in Pakistan. I mean, you've done extensive experience with litigation in SRHR, and the question for you perhaps is, how have the court decisions or judicial interpretations of reproductive rights, including access to maternal health, evolved over the past 2 decades? What are the emerging trends in both, I suppose, progress or maybe regressions that you are observing in how the courts address issues of abortion, gender identity, and bodily autonomy in general? Over to you, Sarah. Thank you very much.
Sure. Thank you so much. And thank you very much for the opportunity to speak about strategic litigation on this issue. So as you mentioned, I'm based in Pakistan, and that's where most of my experience is. So I can talk a little bit about how courts have. I've also observed developments in South Asia as well as Southeast Asia, so I will talk a little bit about that as well. As far as how courts have their jurisprudence around reproductive rights has evolved over the last 2 decades or so. One issue that I'll focus on is access to maternal health services. So in South Asian courts in particular, we're talking about India, Pakistan, and Bangladesh. So here in the last couple of years, we've seen that courts have recognized the right of women to access affordable, quality maternal health services and the obligation of the government to provide these services without discrimination. And I'll add that many of these cases in South Asia, some of the crucial cases in South Asia have actually evolved and been filed through a network known as the SRHR network, the South Asia Reproductive Justice and Accountability Initiative, which was spearheaded by the Center for Reproductive Rights. And Payal, who's also here as a panelist, played a very key role in some of these cases. What we have with these cases, and the first case was the first judgment that came out was in the Delhi High Court. I believe that it was in 2010, which clearly set forth the obligation of the government to provide affordable maternal health services to all women. And the case was filed on behalf of a woman who actually experienced maternal mortality on account of her inability to access services because she was denied these services on account of her low income. And in that case, the court recognized that the right of women to reproductive health services is a fundamental constitutional right. And then following this, a number of
I think we can't hear Sarah anymore. Is it just me? Well, there's a bit of a delay.
Similar cases were filed in India, and in a sense, inspired by in Pakistan, a woman who had developed obstetric fistula at home, maybe low bandwidth. Is that better? I'll just yeah. So
Continue.
the case was right. The case was filed on behalf of a woman, as I said, who developed obstetric fistula because she did not have access to a health facility or a skilled birth attendant, and that case led to a series of directions to the government to take specific measures to implement maternal health policies. And these cases, I'll emphasize, were made possible because, again, the constitutions of these countries recognized the right to health as a part of the fundamental right to life. The constitutions in these countries also recognize the right to equal protection under the laws, and these countries had also entered into international human rights treaties. And these fundamental constitutional rights, as well as international human rights treaties, were invoked by these courts to pass specific directions to governments to take policy measures to implement maternal health policies and provide accessible and affordable maternal health services to women. So, in this respect, we see that there is evolving jurisprudence, positive jurisprudence around access to maternal health services and the obligations of governments. At the same time, another area in which we see judicial interpretations evolving is around the area of women's right to make decisions about their reproductive lives. And this is connected to the right of women to bodily autonomy. And this includes the right of women to access safe abortion services. So, one of the groundbreaking cases in this regard came out of India in 2022. This was the landmark case of X v NCT, in which the court held that even unmarried women have the right to access abortion services, and made it very clear that the decision to take to have an abortion is so closely connected to a woman's physical well-being, mental health being, emotional well-being, and therefore that decision is very much grounded in the right of a woman to health, a right of a woman to dignity, and the right of a woman to her privacy and personal autonomy. In a sense, that was a groundbreaking recognition of the right to abortion being linked to a woman's right, uh, many other fundamental rights under the Constitution. A few years before that, there was a positive development in another court. South Korea's constitutional court declared that the ban on abortion in the criminal court in South Korea was unconstitutional. And then before that, many years before that, it was Nepal actually, which in the region probably took the lead in the Supreme Court of Nepal, which declared that the government has an obligation to develop a legal framework which allows women to access abortion services. So again, over the years, we're seeing that courts are moving in positive directions. And again, recognizing that the constitutional rights as well as international human rights obligations require states to respect and promote reproductive rights. At the same time, I think that we should also always be a little um, uh, uh, we should also adopt this approach of strategic litigation with some degree of caution. We should always be aware that courts can also be a site for backlash as well as regressive norms. Even for example, in the case of India, we saw that after this very positive judgment of the Supreme Court, just a year later in 2023, a woman was denied an abortion because at that time she was 26 weeks pregnant, and the court held that at this stage, the fetus has a heartbeat, and therefore a woman should not be granted an abortion at that stage. So, reproductive rights in courts are something that are always subject, as I said, to backlash. And so, as civil society activists and as women rights activists, when we are developing litigation strategies, we should always keep in mind that there are certain circumstances, and these circumstances depend on the judicial climate. It depends on the specific courts that we're approaching. It also depends on the political climate, that we may get decisions, judicial interpretations that could also actually represent backsliding. And so with that, I think um, I will.
Thank you, Sarah. Thank you very much for your input. We did follow you despite the video challenge. And just of course to acknowledge your input in terms of the broader context and the different examples you've given. And I think it makes sense that then Payal is next to give us your experience at Physician for Human Rights and the Center for Reproductive Rights in terms of the intersection of legal advocacy, human rights documentation, and strategic litigation, especially, of course, looking today's webinar at Southeast Asia specifically. And I think it's important to always keep in mind that often it's marginalized people in vulnerable situations who often either get the courts and their rights taken away or use the courts to affirm and protect their rights. So what are some of the remaining challenges that you see in this space? Over to you, Payal, and thank you very much.
Thank you very much. This is a really exciting conversation, and I'm grateful to the O'Neill Institute and to the other co-organizers for putting together the panel and inviting me here today. I think, Sarah, listening to you, I'm remembering we worked together on some of these cases, and I think what I'm really reflecting on is what it took to get to that point, what it took to get to the point where we're able to get these positive judgments. And Dr. T, as the question you laid out really reflects, it took a whole lot of collaboration across movements with lawyers and non-lawyers, and actually a lot of really intense documentation, a lot of really careful case building through fact-finding, through conversations with stakeholders, and being able to show and gather the evidence that's needed to get to these landmark judgments. So for example, one case that Sarah hadn't discussed yet was a case that we worked on at the Center for Reproductive Rights that was on a de facto ban on modern contraceptives that existed in Manila City. And so this was a city ordinance that essentially laid out that the city was going to follow a policy of natural family planning. It didn't say it banned modern contraceptives, but in practice, that was actually what was happening. And we were hearing from civil society partners that overnight modern contraceptives were disappearing off the shelves in city health facilities, that individuals from NGOs that were trying to deliver contraceptive medicine were being pushed off their motorbikes and their stash taken. So it was quite an aggressive implementation of an executive order that on its face did not actually ban contraceptives. And so part of our task was really to understand and to gather in a way that was more than just news reports, but a way that could hold up in court the evidence needed to show that this executive order was acting as a contraceptive ban and that it was resulting in real harm to individuals and families in Manila City. So we began this work by doing this rigorous documentation, by working together with national partners and with community-based organizations to reach out to survivors or individuals, I guess, that were affected by these contraceptive bans to understand the harm to health that was occurring, the real barriers that were being caused by this executive order in terms of access to supplies, and then the choices that individuals had to grapple with as they were trying to decide whether to buy contraceptives on the market, which they couldn't afford, or if they could pay for food for that day. And it was a really, this was back in like 2010, 2008, 9, so 10. And it was really a time where I think that right to contraceptives was something we were building. There was a recognition in ICPD and in others that reproductive rights are human rights, and we need to take this as a rights-based approach. But, actually, as somebody said later on, when you think about the harm that deprivation of contraceptives cause, it's very easy to think of it as a lifestyle choice. It's very easy to think of it as, oh, this is just something optional. And it's only really when you start speaking with individuals that are facing health risks from unwanted pregnancies, have now had 8, 9 pregnancies, and are have uterine prolapse and all sorts of other issues occurring. Or when you see, kind of legacies of very young children becoming, pregnant at 11, 12, and then not 11, 12, sorry, for contraceptives, like 11, 12, and not being able to access emergency contraceptives and other pieces, that you start seeing the ways in which this is leading to really robust harm. And so what we were trying to do is tell these stories, and trying to tell these stories in a way that really revealed for the first time how contraceptive access could lead to profound violations of human rights, and that this was not an option. This was not a lifestyle choice. This really was leading to death and suffering. And so we began with this documentation. And actually what we found, what survivors shared with us, was this was actually the first time they themselves understood that what had happened to them was a violation of their rights, that they had seen this as something that just sort of happened. I guess it is something that we don't deserve, and we just need to deal with the consequences of what what this policy is leading to, right? All of these unwanted, unintended pregnancies, and really inability to, to work, to pursue education, to do other things that would allow them to break cycles of poverty. And in having these conversations, in documenting in this way, it actually prompted a group of individuals, of families that were impacted by the executive order, to want to engage in litigation. And so then we started to work together with our national partners and local partners to put together a case in the national courts. But the reality was the Philippines was quite conservative, and the courts were unlikely to lead to a positive judgment. And we knew that. That said, we still knew we had to start in the national courts, because any advocacy that we did later would rely on showing that we did try that route. And so we did file in the national courts, and I'll spare you the details on how that went, but suffice it to say, it was not a positive outcome. But simultaneously, we started to build an inquiry request to the CEDAW committee. And so this is under the optional protocol to the Convention on the Elimination of All Forms of Discrimination Against Women. It's a UN convention, right, on women's rights. And under that convention, we filed what's called an inquiry request. It's not a case. It's actually filing on behalf of a group and really asking for the committee to come to the country, do a visit, and document the human rights violations that are occurring. And it's really strategic in a place where the government itself is refusing to recognize this as a violation of rights, which is what was occurring in the Philippines. It took many, many years. And I really want to say it was, I think, about a 7-year-long process. It was not quick. But what it ended up with was the CEDAW committee members coming to the Philippines, meeting with over 60 individuals that were affected by the contraceptive ban, and then actually also sitting down with government officials who until that point had essentially been refusing to meet with civil society, really refusing to talk about what was going on. Ultimately, the CEDAW committee put out a report, and that report recognized profound violations of human rights occurring in the Philippines as a result of the contraceptive ban, and also linkages to other policies, including the Philippines' essentially total abortion ban, or almost total abortion ban. When we held a consultation launching this report, we invited the City of Manila officials to come, along with survivors and others. And the City of Manila officials actually issued an apology in that moment, in that consultation. I think it was such a clear and damning piece of opinion that I think they felt, as they were facing survivors, they had to apologize for what had happened. And that was so incredibly meaningful to the individuals who we had, put together this inquiry request for and with. It also sparked a process at the national level of the National Human Rights Commission, then conducting periodic inquiries into sexual and reproductive rights, looking at different marginalized subgroups. So they did it on SRHR broadly, but then they did ones focusing on individuals with disabilities or individuals more like indigenous populations and fisher folk. And so this was really a profound sort of landscape shift that was created through this inquiry. So we learned many lessons through this process. I think the first was that litigation cannot stand alone. It's a multi-year process. It needs momentum to be sustained. We used a lot of advocacy at the national level, but also at the international level with requests to special rapporteurs like Dr. Teed to the Universal Periodic Review process, to treaty monitoring body reviews of the Philippines, and really kept trying to build awareness and pressure. We recognize that lawyers cannot stand alone. We worked together hand in hand with movements of grassroots activists, public health advocates, medical sector, community organizations, and others to be successful. We continue to really build on evidence and to put forward evidence at every stop. This was something where there's frankly a lot of gaslighting when it comes to sexual and reproductive health policies. Politicians will often pass laws and policies and tell you they will not harm you. They're actually to protect you. And this gaslighting occurs everywhere, all around the world. And it's very important in the face of that kind of gaslighting to put forward evidence of what's happening. And I say this all around the world, sitting here in the United States, where I'm watching our government do this as well. At Physicians for Human Rights, I just conducted a research project together with colleagues in the state of Idaho, which has only one medical exception to its abortion ban, which is to prevent the death of a pregnant person. And yet the lawyers for the state of Idaho are trying to argue that the denial of abortion occurring in the state, even in medical emergencies, is not due to this very narrow medical exception, but actually due to bad doctors. So not bad laws, bad doctors. And our work is really to do the fact-finding, to collect the evidence to show that actually doctors all around Idaho, but also outside of Idaho, are seeing the impact of this policy. It's not one bad doctor or one bad apple. There's dozens of patients being sent out of the state, airlifted out of the state, having medical emergencies because of the abortion ban. And so that actually led to this report that we put together on the impact of the abortion ban being cited by the US Supreme Court in blocking enforcement of Idaho's law. And so that critical component is evidence. Equally critical is having contingency plans, especially where courts are not favorable or accountability is difficult to pursue. You really need to map all available forums and know what each one requires. And that was something we really did here. And then the last piece is to underscore that litigation is incredibly taxing on survivors. And all the more taxing on survivors that are not, don't have the economic means or don't have kind of a formal, robust structure of support, especially as attacks start mounting, right? It's very public and visible to be involved in litigation, and there can be a lot of backlash. And so it's really important to be working together with community organizations, to be mobilizing psychosocial support, to really think about the risk of re-traumatization and to engage into litigation with that awareness. And I say that in my current role at Physicians for Human Rights, where we've been working with survivors of election-related sexual violence in Kenya for over 12 years from when we filed the case, over 17 years from where the violence has occurred, and we still are waiting for the compensation to be issued. And so as we're supporting survivors and moving forward in this case, continuing to fight the good fight, we also really are trying to work together with our partners to ensure they have the support they need, because it can be very demoralizing and runs this risk of re-traumatization if one isn't careful.
Wow, thank you so much. And for that very important reminder at the end, at the cost of litigation and not just the monetary cost. Yeah, and I think it's really, really important. And Tilaga, coming to you, just from a structural systemic barriers conversation, we know, and I often say that people are not vulnerable. It's that there are systems that make them vulnerable, right? There's particular ways in which societies are set up that make people vulnerable. So when it comes to young people, LGBTQA plus persons, for example, sex workers as well, what are some of the barriers that you see that keep these people from effectively accessing the court. And I think, Payal, you started speaking a little bit about how costly it is, right? And so in your experience, Tilaga, can you take us through what legal or advocacy strategies have proven effective in overcoming some of these obstacles in your area, and how you've adapted or scaled to ensure broader access to justice?
Thanks so much for the question, and thanks so much for having me. My name is Raga and my pronouns are they, them. And I guess I will cover this question by looking at the context in Southeast Asia and perhaps a little bit more the context of Malaysia, where I personally, live and work in. So in Southeast Asia, there are many barriers for LGBTIQA people, sex workers, and youth in accessing the courts to assert their rights. So by and large, sex work is regulated at best and criminalized at worst in Southeast Asia. I think only one country in Southeast Asia that has a better regulation than the serious criminalization that we see across Southeast Asia. And of course, this then has a knock-on effect on all areas of a sex worker's life, from being able to access justice to access healthcare and all sorts of other services. And as I said, I come from Malaysia, which is a Muslim majority country. And here we see additional and unique barriers faced by Muslim women and LGBTIQ people. These include criminalization, penalization, and regulation of gender, sexuality, sexual acts, and bodily autonomy and integrity through laws, fatwas, or religious edict, and other legal and non-legal religious measures, right? So I think that is also important to look at because a lot of times we do see the intersection between the legal religious elements in regulating, bodily autonomy, sex, sexuality, etc. In Malaysia, for example, pregnancy out of wedlock is still criminalized for both boys and girls. So it is not just a gendered law now. I think, as my colleague Shanti Dariam would say, this is a practice of equality in misery, where, everybody is equally criminalized. And at the same time, child marriage is also still allowed. Genital mutilation for babies and children assigned female at birth and intersex people are still also pretty common. As for genital mutilation for babies and children assigned female at birth, it is encouraged and institutionalized through state laws and as well as fatwas. Specific to LGBT people, I think there are many challenges that we face. This includes, firstly, of course, criminalization. In Southeast Asia, at least 4 countries still maintain criminal laws against LGBTQ related sexual acts, identities, and expression. I think it's also important to note that, for example, in Indonesia, while LGBT people are not criminalized based on sexual acts, but they are broadly criminalized through pornographic laws and other laws, which still have the same sort of impact which still has the same sort of chilling effect on all areas of life, right? And I think the criminalization and legal barriers can be overwhelming because we are not just talking about one law. For example, in Malaysia, there are 52 state Sharia laws that criminalize LGBT people based on SOGI. And this excludes other legal and extrajudicial measures that penalize, regulate, and prohibit LGBT identities, expression, and other aspects of our lives, right? I also want to add that one of the new trends that we are seeing in terms of criminalization of LGBT people, and specifically trans people, is the criminalization of trans people's ability to transition. This is something that we are also seeing in Malaysia as at the state law, right? And in this context, I think when we are looking at overwhelming legal barriers and criminalization and regulation, I think in this context, legal literacy is important. And legal literacy includes information about access to justice, et cetera, et cetera. I think from our research, one of the things that we are finding is that within this context of repression and restriction, legal literacy is extremely low, and this is often exacerbated by trust deficit in state institutions. So, for example, one of our research with 157 LGBT people shows that 30% of them did not know how to go about reporting cases of discrimination. Only 17% were comfortable reporting cases of discrimination, while the rest said that they were not comfortable. So, it really shows that the access to justice and legal literacy it's actually quite low. And a lot of times, a lot of LGBT people, or all folks that are marginalized, are not connected and isolated from each other, and this then further dampens access to justice for a lot of people, right? And I think we also, I think the second barrier that I would like to talk about is really bias and cultural barriers. I think a lot of us are aware of this. I think I would like to maybe focus this on the bias in courts that we see. Based on my experience supporting LGBT people and sex workers in court, we definitely see high level of bias by judges against sex workers, LGBTIQ people. And as a result, the chances of getting justice in lower courts are usually lower. And, sex workers, LGBTQ people who are often from economically marginalized groups, often, the only option that they have to get justice is to seek to mount challenges in Supreme Courts, constitutional courts, or courts equivalent to that, right? And a lot of times in a context where, there's low legal literacy and lack of access to legal representation, this can be extremely difficult, right? So people end up not getting justice at the lower court. And also end up, absorbing a lot of economic costs as a result of having to pay fines and paying legal fees and things like that. So definitely, I think it is difficult for marginalized groups to get justice through courts, especially at lower courts, especially when the the rights framework is not adequately developed, right? And also a lot of times we do see judges not having a clear and not having a good understanding of discrimination and the impact of criminalization that marginalized groups face. We also see definitely access to legal representation, as folks have mentioned, Sarah and Payal, and the financial cost of it all can be really prohibitive. And because of the stigma attached to issues related to sex, sexuality, SOGI, SC, it can be even more challenging to find friendly lawyers. And this can be even more difficult for people outside of urban areas, right? And this is the experiences that we all have. And access to support is also definitely really low. I think especially in the context of criminalization and stigmatization, people often are isolated and lack support. In one of our research, we found that trans people who live with family members who face violence opt to not go back home and heal, and stay outside or with their friends because they're afraid of victim blaming from their families. And this actually shows the grave situation of lack of support that people face, right? Lastly, I do want to add the same point that Payal mentioned earlier, the stigma and backlash that comes along with challenging certain laws, especially challenging Sharia or religious laws. In Malaysia, especially, a lot of these laws fall under state Sharia laws, the criminalization of sexuality, sex, etc. And there is a perception that challenging a Sharia law, which is made at the state assembly, are equivalent to challenging Islam Islam, the religion, right? And this then adds a lot of backlash and to the litigants, etc. In terms of strategies in overcoming these barriers, I think we have mounted a number of constitutional challenges because we feel like it is important to develop the rights-based framework before we can actually get justice in other courts. But at the same time, I also do agree with Sarah and Payal that, you can, constitutional challenges or legal challenges can only be mounted so many times. And and at some point, then we have to move on to other strategies, right? Yeah. And also, yeah, it is a mixed bag, right? You can get a good decision and you can get a bad decision, right? So, yeah. I would also like to share a couple of examples that I think have worked in the context of Southeast Asia outside of the legal strategy. I think one example that I would like to share is the joint effort by LGBT groups in Vietnam in collaboration with WHO in pushing the Ministry of Health in Vietnam to issue a statement about the harms of conversion practices. And this campaign, as what folks have talked about, was also then supported by public awareness campaign, petitions, etc., to make this happen. The other example that I would like to share is also in Indonesia, where we see the LBH, which is the Legal Aid Network, being a great support for marginalized groups in challenging criminalization and prospective laws that regulate the sexuality, bodily autonomy, etc. of people. I think the other strategy and the last thing that I would like to add as a strategy that I think a lot of queer people and LGBT people are looking at is really strengthening the self-acceptance of LGBT people. Because without self-acceptance, I think self-acceptance, the lack of self-acceptance for LGBTIQ people can become a barrier in really challenging some of these oppressions that are imposed or against LGBT people. Because a lot of times when there is a low sense of self-acceptance, people tend to just accept the discrimination that they face. So I think I will stop here. Thank you so much.
Thank you very much. And the different ways you talk about literacy, so important. Just really, you can't fight for rights you don't even know you have, at the very first instance. And I think, with what Payela is saying, that some people, it's only a documentation phase when they actually realize that they are experiencing rights violations, but to also then in interface with the law. It's also not a pleasant thing, right? That people just automatically want to embark on it. It's a very daunting experience. And so it brings me to the next question that I will ask Her Excellency Sochetra, as well as Sarah, in terms of how do we then improve implementation and compliance of court rulings, right? Because it's also one thing that people go through all of these obstacles to get to the courts to get their rights affirmed. It's one thing to have governments and states then actually act on those and do the right thing. So, in your experience, Her Excellency, what are some of the ways in which we could improve implementation, we can improve compliance with enforcing court rulings on sexual and reproductive health rights?
Thank you very much for your question. To answer your question, how to improve the implementation and in compliance with the right of the reproductive health, I think first for improvement, it both for the law enforcement and also the people to aware about their rights because first, I think we should ensure the clear and enforceable judgment that the court should provide a specific orders, also set the timeline and a responsible agency for implementation of the court order, and also allow for the follow-up or contempt motion in case for non-compliance. And to be
Are you guys also having difficulty with audio? Okay. Let's give it a few seconds and see if anything picks up.
Also, how to train the police, the health worker professional on compliance requirement, and how to equip the government department with resource and technical guidance to fulfill the court orders. Third, to strengthen the legal empowerment and also conduct the public education campaign on the sexual reproductive rights and the court outcome, and also to support the community practice, community parallel to help a victim navigate enforcement procedure and expand access to legal aid for follow-up action on non-compliance. For to engage with the civil society and media, such as the NGO, the enforcement and public compliance and response to use the strategically litigation to reinforce system accountability and partnership with media or to support Victoria and gap in implementing and also use strategic litigation with implementation in mind by select some case and to show about the politically feasibility and well support by evidence and advocacy effort, and also how to prepare the enforcement plan and link litigation with policy change and grassroots mobilization. But we have people in Cambodia have a limited capacity on legal literacy and public awareness. So there should be the advocacy campaign or public awareness about the rights on the reproductive health and how to exercise their rights, especially youth, women, and marginalized group, to aware about their rights and how to exercise their relevant to exercise their right, and also to know about their the existence of relevant court ruling to and also work with the community to support them at the community levels. And also we have to engage with also our key partner, development partner, for the funding support to the government institution for set up the program for the capacity development of the law enforcement officer about the sexual reproductive health and rights.
Thank you so much. And Sarah, maybe to you on the same breath, what are there any cases currently, for example, that we should be paying attention to? And from your standpoint, how do we then support people with ensuring their rights are protected through how courts and at least states, are compliant with court rulings?
Yeah, sure. So I think one of the things that help towards implementation of court rulings. One of the things that I think that we've seen that have worked is if courts themselves are vigilant and aggressive about enforcing their court orders. So some of the cases that I've talked about have been kept alive in courts for many years. So the obstetric fistula case in Pakistan, for example, we litigated that for over 7 years, and the court kept passing these interim orders to the government to file progress reports and show what measures it had taken to implement maternal health policies, to recruit additional gynecologists to public hospitals, upgrade public hospitals, and so on. So I think one of the things that we can do is as advocates is request that courts keep cases alive and keep pushing for their orders to be implemented. But I think one of the things that really helps in that regard, because I think one of the themes that has run through these talks is that, of course, with the litigation strategy, a lot is going to be dependent on the bench, right, on the judges and how they are approaching these cases. And I think one of the practical steps that we can think about as civil society to be able to secure better judgments is to have consultations, trainings with judges. And I think, at least in the context of Pakistan, and I think for much of South Asia, civil society engagement with judges through judicial academies has been very helpful in sensitizing judges towards these issues, making them aware of positive jurisprudence in other countries. And I think that those have actually led to positive decisions. And often we can't see the outcomes of these trainings, consultations with judges in a short period of time, but in the long run, I think that they can be quite visible. So I think one of the practical measures that we can take to actually make strategic litigation an effective tool for civil society organization is to think about how we can engage with judges. And I think judicial academies is one way to do that. And I think that another very important measure that we should take is to ensure that with all litigation strategies, civil society actors are very involved and active from the beginning. So with the documentation, with the evidence collection that's needed to build a case, to the extent the civil society organizations can actually be petitioners in cases, we should definitely have them added on as parties and then keep them involved throughout the case so that when the time comes for implementation, they are invested in then doing advocacy with the government to push for implementation. I think a lot of the times when we see that implementation is not as effective or there's a lag in it is because by the time you get to the stage where the government is supposed to implement the court orders, civil society actors aren't as engaged, aren't as involved because, as the other speakers mentioned, litigation is such a taxing process. It takes time and it takes money. So I think we need to think about how we can resource civil society organizations so that their capacity is built to engage with cases right from the stage at which we're developing the litigation strategy to the stage where it comes to enforcing the litigation strategy. So I think those are a couple of practical steps I think I can think of that we can use to make these litigation strategies more effective.
That's great. And then you've started to answer some of the questions we have in the Q&A because people are already reflecting, right, that litigation takes long processes, that there is a need for resource mobilization. And Payal, maybe coming to you because you started to allude to the the cost of litigation beyond just the monetary nature of it. And Isabel had a question about the emotional weight of litigation for victims, and how do we then use practical strategies in your work to truly remain centered on their needs and their voices and well-being throughout these processes. And I mean, this is a tough question when we know even the space for civil society to participate in political processes is also shrinking. So how do you balance and how do you practically go about that?
Thanks so much. It's a really good question. And actually, it's one of the questions that brought me to the current organization where I work, which is an organization called Physicians for Human Rights. And people often are physicians, but what does that mean? What are they doing? And really what we try to do with this organization is foster multi-sectoral collaboration. And a lot of what brought me here was the recognition that lawyers really can't do it alone. There has to be, there's the component that's occurring in court, but actually there is so much, right, day to day that's occurring in people's lives. And for anyone to be involved in litigation, there needs to be a scaffold around in terms of providing psychosocial care, but also taking the care to explain the process, to advocate inside a court, but also outside a court for protection of identity, for measures for witness safety in the courtroom, but also outside of the courtroom, for example, engaging with the media. And, one thing we just did around this Kenya election-related sexual violence case was doing a kind of a session with editors of major newspapers to talk about what the case is and to answer questions so that we didn't see the media then repeating misinformation, feeding into stigma or driving backlash against survivors. And so this is the kind of, this is what I mean when I say, we really have to think about litigation holistically. We have to think about it in these kind of, multi-sectoral referral pathways of how the person got here. How do we ensure that they have a sense of ownership in the litigation journey, that it's actually a healing process. They can provide feedback when things are frustrating. This case that I was just talking about, election-related sexual violence, the court held the case online. And actually, the case on election-related sexual violence was Zoom bombed by somebody who then started airing pornography during the session. And so, during a court hearing. And so these are really, really extreme examples of what can happen if care is not taken. And part of our work immediately after that was to try to mobilize sessions for, kind of to process what's happening, for the survivors to talk about what it meant for them, to offer linkages to psychosocial support after that, because it is traumatic to go through that kind of experience again. And that is part of our work, is to be able to understand that the court system is an opportunity, but it also, it has a risk, as Sarah said, right? It can be a dangerous site in some ways. And so it's really important for funders, for example, to think about litigation as something that isn't just a one-off, right? It's not a few hours of someone's time. It is a really robust strategy that needs to be supported and put in place. I will say there was a question in the chat, I think, around resourcing. And I will say, speaking very honestly, I see a somewhat of a dangerous shift away from support for human rights advocacy and for this type of strategy. And I think that is something that does concern me, because litigation strategies, they are long-term strategies. They can't be funded in a one-year grant. They actually need to be supported in longer-term grants, because it is a longer-term process. And courts, sadly, do not adjudicate cases mostly in just a year or even just in 2 years, and strategic litigation all the more. And so it is really important for funders to be thinking about how they can really provide flexible funding to allow organizations that are trying to engage in such efforts to do so in a way that is really responsive to and ethically kind of responsive to the individuals that are going to be petitioners in these cases. I really want to echo Sarah's point as well, which is that having civil society organizations as co-petitioners is really critical. It does allow for a lot more kind of it relieves a lot of pressure on individuals, because then, when there's the media needs a quote, when, they want to interview somebody affected, there's a little bit of a support there. And so it doesn't always have to fall on an individual survivor to tell their story over and over again, but also that it holds the legal team accountable to a movement. And to ensure that, right, they're not just making the arguments that are strategic to win in court, but also making the arguments that will actually resonate for communities and allow healing and transformation. And so I think that piece is also very, very important. And then the last piece I want to reflect on is the piece around when it's not safe to file, or when the national ecosystem is not actually in a place to be able to deliver justice. And we see that, for example, in my current job, in Ethiopia, for example, where, there's, there's thousands of cases of conflict-related sexual violence that have occurred in Tigray and in Ethiopia. The context right now is quite challenging in terms of prosecution for those international crimes. There are really great efforts underway, but this is a long road. And for individuals on the ground, it doesn't always feel safe to be speaking out and to be engaging. So what we can do in this moment is to support really robust documentation, and to do that in a way that allows us to be able to seize the moments when they do arrive for accountability. And, part of that is really making sure that we are thinking about the pathway for reporting of sexual violence, trying to avoid the need for re-traumatization, like of re-interviewing, which can lead to re-traumatization. So here too, I think this multi-sectoral collaboration is so important. If a survivor comes to a health facility, it's important that the physicians, for example, or the nurses or other health workers are trained on how to do survivor-centered documentation, but also how to collect the kind of evidence that is going to stand up in accountability processes down the line. And so that's another area where we try to work together in doing really meaningful and thoughtful documentation with the idea that, we want to be ready in this moment to both provide immediate care, but also to package and gather evidence needed to pursue accountability when the tides shift, and when it's possible.
Thank you very much. I like that, when the tide shifts and when things are possible. The moment for litigation is not always ripe, no matter how urgent the need is. And I think that's why it's so important. And this maybe coming to Tilaga about grassroots activism, right? And locating the issues on litigation not just as isolated or solitary activities, because we know that in some instances, no matter how much we wish certain things could be, they may not necessarily be the right time for litigation. We have to be respectful of people's consent, right? You have to be respectful of people's their own journey in how they even see what justice looks like, right? Because not every victim thinks like litigation or the outcomes of litigation are necessarily even justice. And so how do we then navigate, on the one hand, really restrictive, conservative jurisdictions and societies, but on the one hand, there's really deep desire for freedom and for us to really truly be, having our rights realized and protected. And, in the chat, people are talking about, Consolanata, for example, is talking about, the barrier for preventing a deeper, sustained collaboration across legal, civil society, and LGBTQA plus actors, right? To counter this backlash and legal restrictions. So there's a lot. This pot is dynamic. There's a lot happening. And despite it all, we still hold static litigation important. We still hold the process itself very, very key. So take us through, in your different experiences, how do we mobilize grassroots activism? Where do we root and locate ourselves in these very difficult times, but also conversations?
I must say, if I can answer this question, I can solve world hunger tomorrow, right? Uh, no, I'm just this is a massive question. And I think this is a tough one. I also want to say that I have no legal background. And I'm like a queer person who is invested in strategic litigation as a tool, right? And I think I think this is a massive challenge for us as a group that is invested in strategic litigation as a strategy. Because we see this in a context of criminalization like Malaysia, it is important to use strategic litigation to develop the rights framework so that we can affect broader change. But in this conservative environment, I think self-censorship is extremely high. Fear of safety, security is also equally high. And this is not just among everyday LGBTIQA people, but it's also among human rights defenders who may feel like maybe this is not the right time for us to be taking on like visible challenges, right? Or visible to adopt visible strategies. And also, like through our research, we talked about evidence a lot. By and large, our research is showing that within this sort of environment and context, a lot of people want to migrate. And the desire for migration to places with better protection is so much higher within this context, right? So the challenges that we face are quite high, especially when we are operating within a restrictive and conservative environment, right? And I think so for me, I think I totally agree with all the strategies that have been shared by everybody else. I also want to like echo and maybe I'll probably repeat some things. I think this is where maybe like legal literacy is still extremely important among marginalized groups and grassroots folks because I think it is within this context, it is important for people to remain politically conscious and also understand their power, right? In the face of repression, oppression, etc. And I think like without like what we talked about earlier, if we do not understand our rights, then it is difficult for us to like challenge the discrimination that we face. So yeah, in this context, definitely important to do that. And at the same time, also looking at self-care, collective care, etc. I also think that I also agree that having spaces for learning would be important because these legal challenges, and we have seen this through our context as well, how people have become inspired from cases that they see from outside of their context, right? And how things are possible. And for example, even I was inspired by the 377 challenge in India. And when we mounted our challenge, we cited the Nalsa case and other cases in our legal challenge as well. So a lot of times when we are looking at strategic litigation, these are not isolated in events that take place, right? They are very much connected within the global shifts that are taking place legally. So I do think that in that sense, it is important for us to continue the learning and sharing so that then it can continue to inspire and also build build better legal precedents, right? And I think, again, I agree with folks, the research and human rights documentation is critical to show ongoing impact. And I think this goes back to the question that you've posed, you know, in the context of conservatism and repression, as what folks have said, self-censorship can be extremely high, fear of visibility can be very high. So, and I think human rights documentation and research provides that solution maybe to some extent, right? By really collating these experiences and analyzing them to reduce the risk on individuals. So I definitely think that evidence gathering is critical in this context so that our experiences do not become further invisible within these contexts and get drowned out by the conservative voices and extreme voices, right? And I think the last, and also I agree that access to urgent response and funds would be useful in pursuing legal challenges. I am also part of a coalition that provides and makes available legal funds for legal challenges related to certain thematic areas like freedom of religion and freedom of expression. And based on these legal funds that have been made available, I can see how collectively we see how this has supported human rights defenders in mounting legal challenges and also in supporting folks with psychosocial needs and also other needs that they have. And I also would like to share that, you know, in terms of resource mobilization, we have adopted several strategies. And I think folks can reach out to like Urgent Action Fund, Asia Pacific, and also Urgent Action Fund, they have like different branches. And they provide really good resources and also very flexible resources for legal costs and also other forms of psychosocial support that litigants and others need. There are also thematic strategic litigation funds that are available based on different areas that I'm also happy to share later. And also one of the other things that we have seen that we have adopted a strategy that we have adopted through our strategic litigation efforts is that, community fundraising can be really, really critical in building movements and also supporting the strategic litigation efforts. When we previously mounted, decriminalization challenges, we actually put on different shows where drag performers and trans women and LGBT folks used to perform. And that really created a sense of community and investment by the community for the cases that we were mounting. So I definitely think that would be quite useful if people have the time for it. And also, like, I also want to say that I cannot stress the importance of intersectional, multisectoral, as what folks have said, advocacy, because, even when and I think this has two parts to it. One, the intersectional advocacy is definitely important in building a comprehensive body of evidence when we are presenting submissions and affidavits to the when we are presenting our cases. Because like I remember that like when we were mounting some of our cases, we had a range of experts looking at LGBT issues from very intersectional point of view. Not so that then it can enrich the perspectives and the judges don't feel like, oh, it's just a bunch of queer people talking about their rights, but really having different experts and different perspectives to provide different perspectives. So I do definitely do think that intersectional advocacy can be very effective in not just supporting grassroots movements, but also in supporting the strategic litigation process as a whole. I think I can stop here for now. Thank you.
Thank you very, very much. And in a very multitasking way, we've managed to deal with the discussion in the Q&A, as well as, have another round of discussion between us, which has really been amazing. And thank you to all of the participants who have been engaging with us so actively in our collective Q&A. And in closing, I just want to invite all of you in very briefly, what gives you hope for sexual and reproductive health rights? So just a brief answer to what it is that's promising, what's giving you hope in the current atmosphere that we are in. And over to you, Her Excellency Sochestra, what is giving you hope in this current moment?
In this current moment, the most promoting area in strengthening the sexual reproductive health and rights in Cambodia, we have as you may know that we have a comprehensive sexuality education program in school that carried out by the Ministry of Education, Youth and Sport, and this program is empowering young people with knowledge and skill to make decisions on the reproductive rights and health, and also and we also have the Sex Up program on youth health that are implemented by the Ministry of Education and Health, and this program is free to access knowledge and skill related to reproductive health. And also another program is related to gender-based violence prevention and response. The promise is strengthen the bodily authority and mental health outcome by focus on the strengthening the multi-sectoral gender-based GBV response group. In this GBV response group, we have in 13 provinces and more than 50 districts, and we are now trying to expand this multi-sectoral working group. And in the sectoral working group, we have the health sector, legal sector, psychological, and also the coordination and the sector. So what is the promise for us is the strengthen the multi-sectoral sectoral GBB working group, and also the implementation of the comprehensive education visual and expand to other school, including the children out school also that carried by the Ministry of Women Affairs.
Thank you very
And
much.
another promotion is the data collection and monitoring for the better evidence lead to better policy and program.
Thank you very much for sharing someone I think could be good practices. I mean, comprehensive sexuality education in all schools headed by the
Yeah.
ministry. We hope that this will be so common and so regular, right, in many areas around the world, because it is key that young people have information and know their rights and that they're enabled to make informed decision. Over to you, Payel, in one sentence. What gives you promise in the current context?
I think what gives me promise in the current context is actually seeing the positive change that has happened in other parts of the world that have overcome, for example, really conservative abortion bans. I look at Latin America, which has such strong examples of what change is possible. And as I sit here in the US right now, but also, working in countries like the Philippines, where we see abortion bans, we see the restrictions and the harm that they're causing. What gives me hope is learning from others that there is change possible, that we can find our way there, and we can learn from each other and build on those successes to be able to blaze our path.
And to you, Sarah, what is the promising area for you in SRHR?
Sure. So I think one something that's very encouraging is when you look at adolescents and when you look at young women, you're seeing that their demand for realization of reproductive rights and their advocacy for themselves is very strong. So that's obviously very inspiring, and that's a positive sign that on the demand side that there seems to be quite a bit of progress. I think that having said that, there is also a sense of fatigue with strategic litigation as a way of meeting these aspirations. And I think one thing that I just like to end with is that when it comes to strategic litigation, we have to look at the long view. If we look at recent successes of the right or the recent successes from the movement that is pushing for backlash, I think they very much had a long view in mind when it came to their strategic litigation successes. So I think that we should not be disheartened, especially when it comes to short-term failures or when we see that we're not getting the results that we want as fast as we want them. But I think that we need to all realize that for strategic litigation to be effective, we have to take a long-term view, and that we need to resource ourselves accordingly. And of course, that requires that kind of sustained collaboration that we were also alluding to earlier. And so it's important to keep that in mind as we consider ways in which we can have these positive aspirations realized.
Thank you, Sarah. And Tilaga, last word to you.
Oh, thanks so much. I think what is promising is really the good models that we are seeing in Southeast Asia, despite the challenges and all of that. For example, the Tangerine Clinic in Thailand, which is a model clinic for trans-Pacific healthcare, is really a great example. And also, we definitely do see we're seeing growing inclusion and pockets of inclusion in Southeast Asia of LGBTIQ people. That's really great. We also think that the establishment of one-stop crisis center and sexual and gender-based violence response can be more intersectional, and we are seeing maybe entry points in expanding those services. So these are all very hopeful things. Thank you.
And to you as the panelists for this session, thank you so much for your insights and incredible learnings that you have shared with us in the different contexts. I know, and as many people have reflected in the chat, that this has really been incredible, and it's so rewarding when you see people exchanging information and contact details, wanting to carry on this work. And I think it's in that collaborative spirit that we really want to continue doing this work, but particularly to all of you for being with us today, to say thank you very much for being a meaningful participant in creating this community that's able to counter these harmful narratives, but also push past and forward beyond what the anti-rights movement are trying to do. And I think based on national, regional, and international court processes, the different work that all of you do, we know that the law is a catalyst for change. We know that we must, in everything that we do, develop effective follow-up mechanisms for implementation of all of these decisions, and that ultimately we must start with what it takes for the most of us who are left further us behind to thrive. And I invite all of you to please join us for this SRHR webinar series, which will conclude in June, where we keep exploring not just how to push back, but we want to push forward. We want to be strategic. We're in this for the long term towards justice after all. This is about bodily autonomy. It's about bodily integrity. It is about our rights. And of course, our rights will not wait. Everything is urgent. And I want to say thank you very, very much to all of the participants as well for staying the course with us in this webinar. And thank you to the panelists once again. I'm Dr. Tlaleng Mofokeng. Thank you so much for being with us.